Oh, they're not ready yet. Well, y'all let me know when you're ready. You good? Okay. Okay. All right, well, good afternoon. We'll get started. Running a few moments late, but we're glad you're here. August the 25th, City Manager Zanoni will come and give you the statistics and kind of where we are with our COVID numbers. Annette Rodriguez then will come and give us some information concerning the health district and what we got there, and Judge Canales will be making some statements, and then I think Dr. Byrd, we're switching up on you this week. He's coming on Tuesday. I think his college teaching schedule clashed with our schedule, so we're making some adjustments for him. So he'll be here today, and we want to get started. I think we also kind of want to express a sigh of relief and some thanks that the hurricane didn't come our way, either Laura or Marco, but we do want to remember those up in East Texas and Louisiana that are being hit by that. We pray for their safety and their health, and in addition to the pandemic that they're facing over there and that we are here. So every day is a new challenge, and so we just got to learn to roll with the punches, and hopefully the punches will stop pretty soon. But at this time, I'd like to call Peter Zanoni, our city manager, to come keep us updated and as what we are in the numbers and any information he might have for us.
Afortunadamente, la información que tenemos en cuanto al huracán es que no estamos en su trayectoria, pero esperamos que todas las personas que se encuentran en la trayectoria de ese huracán no tengan ningún problema con la tormenta. Ahora nos va a dar la presentación el administrador de la ciudad, Peter Zanoni.
Hi, Tony. Okay, good afternoon, everybody. I'm Peter Zanoni, Corpus Christi's city manager. I'm going to provide you an update on our cases. We're reporting daily. We place this on our website and do media releases. And we're doing these live updates twice a week now on Tuesdays and Thursdays, primarily to manage around the city's budget development process, which is going on as well. So I am going to provide you an update on the cases here live today, and then we're going to show you changes in hospitalization and number of deaths as well. So today's update is going to be, I'm going to need to provide a little bit more explanation. We have another surge event going on. We have a detention center near Robstown that has an outbreak situation going on. It started last week, so the numbers are going to be impacted by that facility that has both inmates as well as staff that are coming down with COVID. They were surge tested, or we tested the whole facility last week, so the numbers are coming in now, and I'm going to walk you through that because it causes an increase in our numbers, but it's isolated to that location. So similar to other outbreaks that we've had in either senior facilities or meat processing plants, this detention center falls into that category. Okay, so on this first chart, we're going to see the number for today of new positive cases is 158. And you can see that that number I'm going to show you in a minute here includes both the cases from the detention facility, which is a total of 86, and then the number of new cases for our normal area, or the area we're generally reporting on, excluding the detention facility. That number is 72. So 72 and then 86. You can see it here. Let's look at this, and then we'll go back to the other graph. So 86 is from the detention center. 72 is from our health district normal reporting process. And then the middle 10 cases, that's from our data drops from the state that we're still getting. And those have been distributed to the appropriate day. They were not from today, the 25th. So we go back in time, and I'll show you another chart that shows you that. So 86 detention center, 72 from today. Let's go back to the main slide. So the 158 includes that 86 and 72. And you want to use 72 to kind of compare it. So 72 today, say, compared to 83 yesterday, 47 and 51. If you look at the 231, that includes the detention center. That was the first event of cases reported. We had 171 from the detention center alone for that day on Friday. There were 12 reported on this day, on the 22nd, and then 0 and 0 on Sunday, Monday. Okay, so you can see we're trending in probably the 80s or so without the detention center outbreak. And then we'll look at this chart one more time here on the next slide. Now you can see it. I think we'll probably still get a few more from the detention center, Annette, over the next couple of days still. So we'll continue to see that number, and we're making note in our material that we put out to the media and the community. So then let's look at this chart here, the next one. This is a more long-term one. This one shows health district numbers, outbreak numbers in one, but it also isolates the state data drops in yellow. So as we get those state data drops, what it is we get a data set for many days in the past, and we'll go back and place them into the right day, and that's what you're seeing here. So the state numbers are from our general area, from Nueces County. It's just they're managing the cases, and then they tell us, and we put them in our database. So you can see the trend went up around the 15th of July was our peak, and it's coming down. But the jail or the detention center outbreak is going to cause it to kind of level off a little bit here, and you'll see that in another chart. This chart is a good one in terms of showing that our recovered cases is now greater than the active, or has been. So it's 57% of all the cases are in a recovery state. Over 10,300 people have recovered, but that does mean we have just under 7,700 persons that are still active with the virus. Our change in hospitalizations is that the number of people in the hospital recovering decreased by 1. And so yesterday we had 209 in the hospital. Actually, I'm sorry, it wasn't 1, it was 11. Yesterday we had 209, and 10 is the number. Today we have 199 in the hospital. So a decrease of 10 persons, with yesterday being 209. And then today we have 199. And then of those 199, 79 are in intensive care, meaning they need more specialized treatment. And so 79 in intensive care, and that is an increase of 2 from yesterday, where we had 77 in ICU. And then we've had a number of deaths to report today. So 327 total deaths being reported for Nueces County. Yesterday, we had 316, and so that's an increase of 11, so 11 additional deaths. There was a little bit of a, not all of those actually took place yesterday. There was a little bit of a catch-up from some of the facilities. So there were not exactly 11 yesterday, a little bit fewer than 11, and then some from some prior days where the data is just now getting to us. But a total of 327 to date on the deaths. Okay, and then our final chart here shows our running trend since the beginning of time in the yellow line, the red line. And then you can see the daily counts in the bluish purple, or the blue here. What you can see on the end, because of that detention facility, our cases are kind of leveling off. They were going, probably would have gone more straight down. But the detention center that has had 200 and, let me see, we have it here somewhere. The number at the detention center is 269. So those cases are in the bars over here. So with that increase of 269, it's causing this line to kind of level off instead of continuing to descend. And I have two daily averages. This is looking at the last 7 days. So the daily average with the detention center number of cases is 116. That means the daily average is 116 new cases. But if you take out the detention center hotspot, then our number of cases per day based on the 7 days is 78. So we're making progress there a little bit. It was a little bit higher than that last Thursday, and it was a lot higher than that in July. Okay, so that concludes my update on the numbers. We're going to get that translated by Gabby into Spanish. And then I think Annette is going to come up next, our Public Health Director, and provide you some additional health information.
Contamos con otra área con un brote de casos por el virus. Se trata del centro de detención ubicado en Robestown, por lo que las cifras están llegando y esas cifras van a ser altas. El día de hoy se reportan 158 casos confirmados por el coronavirus, incluyendo 86 en el centro de detención y 10 casos más provenientes del estado. Esos últimos son casos reportados con un retraso de varios días. 10.328 pacientes se han recuperado por completo, 199 personas continúan en el hospital, 79 están en la unidad de cuidados intensivos. Hoy se reportan 11 fallecimientos, a la fecha los fallecimientos totalizan 327 personas. Con las cifras provenientes del centro de detención, el promedio de casos es de 116 diarios. Ahora la directora del Centro de Salud, del Distrito de Salud, Annette Rodríguez, nos va a dar su reporte.
Good afternoon, Annette Rodriguez, Health Director. We continue to report COVID-19 related deaths. Today, my sincerest condolences go out to each of the 11 families that lost their loved ones due to COVID-19. The Health District's next drive-through is scheduled for tomorrow at 1702 Horn Road. If you are experiencing COVID-19 symptoms, please call our hotline at 361-826-7200 to get scheduled. While we are seeing a decline in the number of cases and hospitalizations due to COVID-19, this is really good news, but we must still be vigilant in our efforts to decrease the transmission of COVID-19. We all want to go back to what we consider normal practices. However, we are not at that point yet. Public health and local leaders are working with the superintendents on operational processes and practices to safely have our children and faculty return to face-to-face instructions in our ISDs. Together, we must continue to push forward. As individuals, businesses, organizations, we have all worked to adapt, to operate under very difficult circumstances. As individuals, we must continue to wash our hands often, we must wear our mask, and we must stay distanced from others. As business owners, you've had to find ways to keep yourselves and staff safe while adhering to the minimum standard protocols that the governor has placed on Reopen Texas guidance. As organizations, we have learned to hold meetings and gatherings virtually. We have all had to adapt to something that is not easy to adapt to: change. The road ahead is still uncertain, but be mindful that every day that passes, we are nearer to having a vaccine and other treatments that could alleviate many of the adverse effects of COVID-19. Continue to wear your mask, continue to stay at least 6 feet away from strangers, avoid crowds, don't touch your eyes, nose, and mouth with unwashed hands, wash your hands often, avoid being close to people that are sick, and do not go to work sick. We're all in this together. Stay healthy, stay strong, and as always, stay connected. Thank you.
Primeramente, queremos enviar nuestro más sentido pésame para las familias de las 11 personas reportadas fallecidas el día de hoy. El día de mañana se va a llevar a cabo la toma de especímenes en el Departamento de Salud. Si bien estamos viendo una disminución en el número de casos y hospitalizaciones debido al COVID-19, esta es una buena noticia, pero debemos de estar atentos en nuestros esfuerzos para disminuir la transmisión. Sin embargo, todos queremos volver a los que consideramos prácticas normales. Le pedimos no bajar la guardia para así pronto regresar a esas prácticas y a la normalidad de antes. Los líderes locales y de salud pública están trabajando con los superintendentes escolares para que nuestros niños y las instalaciones regresen de manera segura a la instrucción. Como individuos, les seguimos pidiendo que tome todas las medidas de salubridad. Como negociantes, muchos han tenido que adherirse a las órdenes del gobernador. Como organizaciones hemos aprendido a hacer las cosas de diferente manera, como reuniones y encuentros en línea. Todos hemos tenido que aprender a adaptarnos. Aunque avanzamos día a día, el futuro aún es incierto. Las buenas noticias es que cada vez estamos más cerca de la obtención de una vacuna, así como tratamientos para ayudar a las personas afectadas por el virus. Ahora la juez Bárbara Canales va a dar su reporte.
Thank you so much, Barbara Canales, Nueces County Judge. I have quite a few topics, all of which I think are very important to discuss with you this afternoon. Before I speak about COVID, I do want to speak very briefly about Hurricane Laura. And although Hurricane Laura is currently projected to be a Category 3 hurricane, it is not expected to make landfall here in the coastal bend. It is expected at this time to make landfall somewhere near Galveston. As we all know, hurricanes sometimes change paths, and a storm that is large like this one is, it can have impacts here in Nueces County. Some of these impacts could be wind, it could be rain, and it could also be surge, tidal surge. The primary concern right now in Galveston is wind effects of the storm. But here in Corpus Christi, and particularly in our coastal parks, we may experience any number of these types of effects. And so I want to always remind everybody that it's so smart. Let's be prepared and let's stay very much informed. To be prepared, I think the best thing to do is to really understand our hurricane resources that we have online. And you can find that at ready.gov. And there is a great checklist to make sure that you have everything that you need on hand. Every time we see a system in the Gulf of Mexico, it should serve as a reminder to you and to your families to make sure that you have that hurricane preparedness plan in your family, that you have those resources and needs quickly on hand in your home. And of course, to stay informed, I want to remind everyone right here on the board, please sign up for Reverse Alert service. This is a fantastic service. I use this so much in my own daily life that I have become so accustomed to it. And I find it to be the most helpful when it comes to understanding what's a true emergency in my community. This system keeps us as citizens informed when we do have emergencies on our roads, or whether evacuations are needed, shelter in place, and any other emergency information, including, of course, our RIP current information. You can sign up today either at the city or the county website. Since I'm representing the county today, of course, I have the nuecesco.com website. It's the same exact service. It doesn't matter which one you go to. But again, please look for nuecesco.com /reverse alert. Okay, so I've discussed a little bit about Hurricane Laura. Let me tell you how it's going to impact us here and how we think that we needed to respond through emergency management. I just got off the phone with Director Scott Cross from Coastal Parks, and he has informed me that he has successfully, along with our team, bermed up the beach access roads number 4, number 5, and number 6. Now, there are still openings, and you can still proceed to the beach today and tomorrow. But look for tomorrow afternoon for those openings to be closed. Why? Because even though this storm is far away, it's going to have impacts on our beaches starting most likely tomorrow afternoon. Now, because there is still the opportunity for these storms to do their own thing, we need to be very ready. And because of our belief in practice what you preach, if I want you to be ready, I want to be ready too. So I'm initiating a virtual emergency operation command center to be activated this evening at 10 p.m. We will not be going into our EOC at the courthouse, but we will be on ready alert starting at 10 p.m. virtually. I believe the city will be doing the same exact protocols. And so that is the background for Hurricane Laura, and we use this opportunity in hopes that you will get this message out via television and other media outlets. It's very important for people to continue to stay alert. Now, I've just talked about the beach and its impacts for these types of events when they occur in the Gulf. And I also want to share with you that this afternoon I posted a rescission order for the nighttime curfew at Nueces County beaches, effective today. You recall that these curfews were in place as part of a protocol to assist law enforcement when we had vehicle restriction closures. After this weekend's event and beach cleanup, I felt that we now were in a good spot to remove these nighttime curfews. As always, we'll constantly monitor the situation of COVID-19 and any other disaster that could have impact in our county. But at this time, we believe that we can now maintain the rescission of this curfew as a good protocol for Nueces County beaches. And I want people to enjoy the beach responsibly. And of course, I'm asking for your patience and understanding when sections of the beach must be closed due to cleanup or debris removal. This is the case around Bob Hall Pier. Around Bob Hall Pier, the beach is completely off limits for your safety, and so we can do everything we can to continue the process of debris removal. We do have crews, just so you know, underway with debris removal, and we're also getting ready for marine debris removal proposals as well. And I just need to reiterate that these construction sites are not safe to have people wandering around, particularly when we have heavy equipment being operated. And again, I just need to really just commend all of the great work that was done this weekend when I got to witness firsthand the power of people cleaning up our beach. And it was really just a beautiful thing to witness. And thank you to Jules Gilliam and the 4-H clubs from all over Nueces County who showed everybody what it means when you can actually harness the power of the young to inspire the rest of us to get out there and get our beaches ready so that all of us can now enjoy them. So that 7 Mile Beach got a lot of cleanup, and over the 250 volunteers actually came out on Saturday. And when we do our part, even though they're little things, they sure do add up to a one big thing. And that one big thing is 7 miles of beach now being able to be traversed by all of us because we were able to clean up all that debris from Hurricane Hannah. So now I want to switch to CARES Act and this very important day. Today here in City Council chambers, a transfer allocation was approved by the City of Corpus Christi, and I want to personally extend on behalf of Nueces County Commissioners Court my heartfelt appreciation for understanding the value of working together. There's one thing to talk about it, and there's another thing when we do it. And today, Mayor McComb, City Manager Zanoni, and the rest of City Council showed what it truly means to work together. And as I met with Senator Cornyn yesterday, we all pledged to work together to ensure that those funds that they've made available in Congress would be directly utilized for the intended purposes of medical care, public health, and personnel. We talked yesterday about how we've put these funds to work in testing and PPE, in creating physical barriers to prevent the spread of coronavirus in our county and city facilities, how we've used it to allow technology to help our court system continue operating remotely. We're so proud of the teamwork, and we shared that with Senator Cornyn yesterday. He also helped to pledge to continue to work on the next coronavirus relief bill, and that was quite good news for all of us here in the Coastal Bend. Part of what we've built with those funds is our COVID clinic, and I have a slide here that will help remind everybody listening that the COVID clinic provides no-cost medical care and advice to those who have had a positive test for the coronavirus. So here's the thing. If you have a positive test or get a positive test from any source at all, the COVID clinic can help you manage this virus. Remember, there is no cure at this point, but what we can do is make sure your body's in the best shape to fight it. And for many, that means monitoring your symptoms at home. And so for some, they will react in a different way and they might need hospitalization. And this is where the COVID clinic comes in. The staff at the COVID clinic can act as your case manager. They can see you in person. They can see you over telehealth, over your telephone or computer screen. You can get an appointment with them. And I'm going to display the number here. It's 826-8019. We have over thousands and thousands of cases. Annette, shout it out for me. We've got how many active cases? I know active 10,000. We have almost 10,000 active cases. If you are struggling or just have questions, you want to manage this virus that has affected you and your body, this number can help you, 826-8019. And the staff at the COVID clinic, as I said, understand symptoms. They understand how the disease progresses. They know when to say to you, you need to come into the hospital or this clinic and you need to get taken care of. They'll understand every step and phase of this virus. We opened this clinic on August the 1st. And so as we are approaching the 3-week mark, we really have seen quite a few patients. And of these patients, we see some uninsured patients. And I think that it's very important. Uninsured patients often don't have primary care physicians. But this means, more importantly, that they didn't have anybody to turn to for information about this illness. So I'm very proud of the fact the city and the county working together have established this clinic. They would have otherwise had to go to the emergency room where their symptoms may or may not have necessitated hospitalization, but making sure that our emergency rooms are not the place for you if you don't need to be there is critical. And so I really believe that we are taking care of the exact people that we thought we would, but it's available for anybody, whether you have insurance or not. Those without insurance, I will tell you, this is just a primary place to get medical advice and assistance. And again, I'd like to have this number and this slide up almost every day. We're going to put it up on our website, but I would like for the media to really utilize this number. It's really important that you guys know how you can get help with here locally, regardless of your ability to pay. So thank you to all that are involved, particularly the Amistad Clinic, who really is the backbone of the medical personnel behind the COVID clinic. And again, sometimes you can have your hopes and dreams realized, and that is exactly what we've done. We've created a resource for this community, and we have made sure the most vulnerable amongst us have access to great quality health care. So in that vein, health care, I'm going to end with convalescent plasma and tell you and remind you that the FDA has given emergency approval for the use of convalescent plasma as a treatment for COVID-19. We have been preaching a little bit about convalescent plasma, and as we have so many active cases, those active cases we pray will become recoveries. But we know already we have another 10,000 recovered patients. And because we do, we know the overwhelming majority of you that have recovered are eligible to give convalescent plasma with your blood donation. With one donation, you can save 2 lives. So as we look for any type of lining, silver or gray, any type of lining, we know that these 10,000 recovered cases in Nueces County means that there are 10,000 potential donors for convalescent plasma. So, you need more information about this, please call 888-0264. Of course, you can always go online at thecoastalbendbloodcenter.org. I get really frustrated talking about this disease sometimes, but when I talk about convalescent plasma, I feel empowered. I feel empowered because it's a way I can say to people, you can fight back. So we want you to heal. That's what our COVID clinic is all about. We want you to get well, and then we want you to give, be able to give that gift of life. So again, I encourage you to be a hero today to 2 other people who are currently fighting for their lives in the hospital. And again, please go online at coastalbendbloodcenter.org. In my courtroom, we always adjourn in memory of, and although I'm not in court and I know that this is merely a press briefing, I feel as I stand here that I would be remiss if I didn't share with you that we have had a tremendous loss in our county this week. Deputy Raul Salazar succumbed to COVID-19 over the weekend. He's a deputy sheriff, and he was very young. We are devastated by this loss of our family member, and I wanted to personally express on behalf of Nueces County and particularly Commissioner's Court our deepest sympathies to the Salazar family and to the Nueces County Sheriff's Office. To lose one of our own is especially heavy on our shoulders today. And so we would ask that all of us remember the seriousness of this disease and how it can take those that are sworn to defend and protect us. I am grateful for all of our law enforcement and first responders, our healthcare workers who are constantly putting themselves so selflessly on the line. And today I'd like to dedicate everything that I've said about preparedness and safety and well-being and, quite frankly, the gift of life in Deputy Salazar's memory. Thank you.
Primeramente quiero hablarles sobre el huracán Laura, el cual se proyecta sea de categoría 3 y se espera llegue a la costa cerca de Galveston. Aquí podremos experimentar varias cosas, entre esas alto oleaje. Esté preparado, pero para más información la pueden encontrar en el sitio ready.gov. Asimismo, se le pide registrarse en reversealert.org, en donde habrá notificaciones relacionadas a la tormenta. En cuanto a la orden en las playas, desde el día de hoy termina el toque de queda, pero le pido que acuda a las playas de manera responsable. Algunas secciones de la playa aún se encuentran con escombros y hay equipo pesado realizando su remoción. El día de hoy el concilio se aprobó una transferencia de fondos proveniente del Acta CARES, la cual ayuda a solventar gastos, entre esos salarios y equipo médico. El día de ayer me reuní con el senador John Cornyn, quien me prometió el aprobar una segunda propuesta de apoyo económico por el coronavirus, el cual va a ayudar a solventar muchos gastos adicionales. Parte de esos gastos es el mantenimiento de la clínica para pacientes con el coronavirus. Esa clínica provee con información para los pacientes. En esa clínica lo van a asesorar antes de ser internado en un hospital en caso de que sea necesario. La clínica abrió sus puertas el 1 de agosto. La semana pasada contó con 15 pacientes, de los cuales 14 no contaban con un seguro médico. Si usted es una de las personas que dio positivo al virus, se le pide llamar al 826-8019. Finalmente, la FDA ha dado su aprobación para utilizar el plasma convaleciente como tratamiento para los pacientes con el coronavirus. Si usted se ha recuperado del virus, entonces cuenta con esos anticuerpos, los cuales pueden ser utilizados en el tratamiento de las personas que aún están enfermas y no han desarrollado esos anticuerpos. Son casi 10,000 las personas que se han recuperado, por lo que contamos con el potencial de 10,000 donadores que pueden salvar vidas. Para realizar una donación se le pide llamar al 888-0264. Y finalizando, el oficial del alguacil Raúl Salazar perdió la vida debido a complicaciones del coronavirus. Le queremos enviar nuestras condolencias a su familia y le pido recordar con seriedad esta enfermedad. Hoy le quiero dedicar el día al oficial Raúl Salazar.
Good evening, everybody. My name is Dr. Chris Bird. I'm here to present the weekly report from the COVID task force. We're moving from Fridays to Tuesdays to accommodate, one, my teaching schedule, and two, because we don't want the cell phone data to be too stale when we give our presentations. So that gives us a view into the future. So Tuesdays seem to be the best day for everybody involved. I want to remind everybody that the task force has two objectives. One is to address public concerns and questions about COVID-19 and the interventions taking place to control the spread of COVID-19 until a cure or treatment can be found. And two, it's to enable evidence-based decision-making by our local leaders to be sure that we're making the right decisions based on COVID-19. Now, you notice that I'm not there in person, and last Thursday I wasn't feeling well, and yesterday I got tested for COVID, and it came back positive. I kind of still can't believe it, but nonetheless, I tested positive, and I think it's important to remember that precautions slow the spread of COVID, and we're doing this to allow a medical treatment to be developed. However, precautions don't eliminate the possibility of infection. And no matter how vigilant you are, trust me, you'll be hard pressed to find anybody that was more vigilant than myself. You can't eliminate the possibility of infection. So precautions do slow down the virus. They do save lives. They do lessen the burden on hospitals, and they do help. So I encourage everybody to continue to take precautions. Even when somebody as vigilant as myself couldn't avoid getting and contracting COVID. That being said, I'm here with you right now. I feel perfectly fine. And so I thought it would be an interesting exercise to see how many people were not exposed to COVID by me because the precautions being taken, not only by myself, but by us as a community as a whole, because we're not all expected to be going to work right now, and not all the students at the university are going to in-person classes, and there's a lot of curbside pickup and takeout. So by working remotely, remote learning, and reduced people at the university, I figure there's been about 4 days in which I could have been infecting 150 people for each of those days. So that's 600 people not exposed because of that. Because I'm not going and eating in restaurant dining rooms, I'm just doing takeout or eating and drinking at home. I'm not going out to the bar. Say that, I eat out a lot in my normal life. So over those past few days, I probably missed 9 meals out at a restaurant at about 25 people encountered per. That adds up to 225 people that I didn't expose to COVID-19 because I was doing takeout and eating and drinking at home. And curbside pickup, I had 2 trips during the time where I was probably infectious. If I went inside and went shopping, I probably would have exposed at least 100 people on each of those trips. It doesn't mean they would have contracted COVID, but it means that I would have brought COVID into that establishment inside, but I didn't because I didn't go inside, I got curbside. So that's an additional 200 people, so about 1,000 people were spared from being exposed to COVID by myself alone, just from these minor precautions that we're taking as a community and because I was following them. Let's see, moving forward. So this is an outbreak. An outbreak can be large or small. It's a rapid rise in the occurrence of disease. This graphic shows how quickly COVID can spread at a transmission rate of 2, where 2 additional people are infected for each person that contracts COVID-19. Now, hopefully, I didn't infect any additional people, but I can't be 100% sure about that. There were a small number of people that were around me while I was infectious. COVID-19 is transmitted through the air, through surfaces, and through contact, direct contact. So we're wearing face masks and face coverings to try to prevent breathing in COVID and contracting it. We're washing our hands and sanitizing doorknobs and fixtures to try to prevent the transfer of COVID from those surfaces to us when we can't help but rub our eyes every once in a while or touch our faces. It's about impossible for us to do. There's interventions that are taking place to help us with the control of the spread of COVID-19. One is stay at home if you can. At the first sign of symptoms, I self-isolated, and that's why I wasn't there in person on Thursday last week. Two, social distancing and wearing face coverings is important to stop the spread of COVID-19. Three, self-isolate when you're symptomatic, or if you're exposed to somebody that tested positive. Four, school closures are ending now, but at least until early September locally. It seems that classes are mostly online. At the university, there are courses that are occurring in person, but most of the courses, I believe, are also occurring online. And lastly, we did go through a few open Texas phases trying to kickstart the economy. And what we found is that we really kickstarted COVID when we opened up Texas to level 3. So Open Texas level 3 was repealed. 1 week later, Open Texas level 2 was partially rolled back to the position that we're in now. And so this has been for several weeks, well over a month, maybe almost 2 months at this point, that we've been trying to get control of the outbreak of COVID that occurred here in Texas. The transmission rate remains approximately the same as our report on Thursday. Our lower estimate is still around 0.9, but now our upper estimate has been downgraded to 1. So that's a positive improvement. In terms of what this means, that means if one person gets infected, on average, they're going to transfer it to one additional person after 1 week. Then that person transfers it to another person. That person transfers it to a third person. And then by the end of 4 weeks or a month, there's 4 additional people that have become infected. The grayed out bodies here are how high the transmission rate could be if we don't do anything to control the spread of COVID-19. So all the things that we're doing right now are having a real effect on the decrease in the transmission rate, and that's why we're seeing a decrease in the positive cases that are being reported each day. Just to zoom in on this transmission rate a little bit more and show you here in the South Texas area, at the beginning of the pandemic, it was up in the mid-2s. It declined during the stay-at-home period to below 1. It increased again with the Open Texas phases. And then once those got rolled back, the transmission rate declined again. And right now we're somewhere right around 1. And right now, this position we're in, we've had the same regulations in place for the most part, for the better part of 2 months at this point. And that's caused a great deal of stability in our modeling of the pandemic. And we really haven't had to change our models that much over the past maybe month and a half at this point. So it indicates that if we keep a steady level of regulation and we all kind of, social distance and do the same things every day to prevent the spread of COVID, we can stay in the same positions. This map of Texas shows the probability that the transmission rate is above or below 1, and 1 would be that keeping even point. And so blue is better. If the darker the blue, the higher the probability that the transmission rate is below 1. We're here in Trauma Service Area U. We're white, so that's right in the middle. The probability that we're above or below 1 is about 50%, which means we're right around 1. And over here in Northeast Texas, there's a probability that the transmission rate is probably above 1 rather than below 1. So overall, this looks a lot better than it did back in June and July. Moving forward, we've had a lot of total cases in Texas and the Coastal Bend area. These maps show the darker, the red or the brown, however you see it, the more cases that there were. You can see that the most cases are centered in population dense areas such as the Coastal Bend, Houston, Dallas and Fort Worth, Austin, San Antonio, McAllen, etc. Here in the Coastal Bend area, Nueces has had the highest number of cases, but B County and San Patricio have also had a fair amount of cases of COVID, especially in this latest outbreak that we've been trying to get a hold of. When we look at the total number of cases just here in the Coastal Bend over time and how that has changed, this blue, these dark blue dots show the total number of cases. Right now we're at 19,694 total cases in the Coastal Bend area. Now these are confirmed positive cases through the PCR test, which is the gold standard test. Any other cases are called probable cases, which are what are reported combined with confirmed cases by the city and county here. But when we want to compare to other areas in Texas, the DSHS indicates that they're only reporting confirmed cases. So that's what I whittled down the data to here. There's been 13,857 confirmed recoveries. So what that means is recoveries from these confirmed cases, and 5,430 active cases right now in the Coastal Bend area. And again, these are confirmed. It doesn't include the probables. So just to remind you, this was the first wave way back here, and we can't even see it anymore. There's so many cases. And then we had some local outbreaks. You can still see a little bit of an uptick there, but that's so small compared to what we went through when we opened up Texas and this really huge outbreak that we've had. And we've been trying to get control of for the better part of 2 months at this point. Looks like we're moving in the right direction, but as Public Health Director Rodriguez said, we're not out of the woods yet, so it's important to stay vigilant. Each week we show the number or the proportion of positive tests from two sources. One is from the Public Health Department in yellow, and two is from the mobile testing that's occurring, and that's in gray. These are supposed to be colorblind friendly colors, so hopefully all of you that are viewing this that are colorblind can see the difference between these colors. Then at the local Public Health Department, the positive rate right now is around 39%. And the reason why it's so much higher than the 19% at the mobile testing is that in order to get tested by the local Public Health Department, like I myself did, you have to have symptoms to be able to get tested. On the other hand, at the mobile testing stations, you don't have to have symptoms. So for example, some of the people, of the few number of people that I did have sort of close contact with, they're able to get tested at the mobile testing facility if they don't have any symptoms. But for anybody that I had close contact with that doesn't have any symptoms, they won't be tested by the Public Health Department. So that gives you an idea of why this percentage is higher for the Public Health Department. You have to have symptoms in the first place before you can even get qualify to get tested there, versus with mobile testing, you don't. So you necessarily expect a slightly lower positivity rate. Now, if you go back to early June, you can see regardless of whether it was at the local Public Health Department or the mobile testing facilities, the percent positives were right around 1%. And now we're well above that at 19 and 39%. So there's still a high percent positivity rate coming back. In terms of the number of tests that are being conducted, these are 7-day moving averages across time. And right now, at the last measurement, we're at 34 tests per day by the local Public Health Department, and 109 tests on average per day over the past week by the mobile testing stations that are present. So there has been a decline, but there isn't a limitation on tests. And so presumably this decline in the number of tests being done is due to a lower amount of people that are feeling like they need to be tested. In terms of our ranking in numbers of cases compared to the rest of the state, the Coastal Bend is moving down, and this is good. In terms of number of cases per day, we're just above 20 per 100,000 per day. new cases. So that's a positive movement in this number for us. And hopefully we can get all the way down to the bottom of this list. In terms of the whole rest of the state, when we compare South Texas, which is us, it's this kind of mustard colored line here, which is experiencing a precipitous decline in the past week or two. We can see that we still have the second highest number of new cases per day per capita, but it's declining, and we're now below Dallas. Different parts of the state that are still having less cases per capita than us is pretty much the whole rest of the state other than Dallas. Now, I moved these labels up, so there's a little bit of area down here for the translator to be able to do her thing. And so hopefully that helps, but these are in the order in which the current ranking occurs over here. So in general, the number of new cases is going down across Texas. That's a positive development. When we zoom in on the South Texas area and take a look at a few of the more populous counties, such as ourselves here in Nueces, San Patricio, and Aransas, as well as McAllen, Laredo, Victoria, San Antonio, and Brownsville, pretty much all of them are experiencing a decline, except for McAllen, which recently has an uptick. This could be from data dumps. We are not able to disambiguate the true date that a test occurred if the data comes from another county besides Nueces. But here is us in Nueces, and you can see that there's been a sustained decline. Now, if you watched City Manager Zanoni's graph, you'd see that he sees a little bit of a leveling off, and I'm not disputing that that's happening. The way that we're fitting the line through it, the smoother hasn't seen enough data points to respond to that leveling off. But it does indeed seem like there is a bit of a leveling off in the number of new cases locally. The good news here is that Nueces is moving down the list, and hopefully some of these other counties in the Coastal Bend area, San Patricio and Aransas, will also be moving down the list. I believe this is the first time that Aransas is coming out higher than Nueces, for what it's worth, marginally higher. When we zoom in on these other counties in the Coastal Bend area, and this is just new cases per day, it's not per capita, you can see that there's generally a downwards trend everywhere except for Brooks for the most part. Brooks is trending upwards a little bit. B County has experienced a precipitous decline. We think that a lot of these cases were from the correctional facility there in B County. San Patricio going down, Jim Wells headed downwards. So these are good signs. Okay, moving on to hospitalizations. We're still ranked fairly highly in the state in terms of new hospitals or people in the hospital. It's not new hospitalizations. Each one of these points is a trauma service area. The Coastal Bend is one of the trauma service areas across the state. And what we hope in the future, if we can continue this low number of new cases, we should continue to decline down this list and get back to where we used to be, which was down near the bottom of this list. In terms of hospitalizations, right now we're right between 40 and 50 people in the hospital in the Coastal Bend per 100,000 in our population. We look at the model which projects the number of people in the hospital on any one day. Again, this model, the parameterization of it hasn't changed for well over a month, and I attribute that primarily due to the citizens of the Coastal Bend area continuing to do their part to social distance, and businesses doing their part to maintain policies that don't promote the spread of COVID-19, but also having the same regulations in place for the most part at the state level for this extended period of time is allowing us to continue to follow this curve. So if we don't change what we're doing in terms of the number of people in the hospital, we have every reason to believe that we're going to continue to follow this curve down. Now, I'm projecting this out 2 weeks into the future approximately, and so we could be down below 150 people in the hospital due to COVID-19 2 weeks from now if we continue on the same path that we're on right now. We look at the types of beds that are being occupied. One type of bed is called med-surg, which means medical or surgical. You're admitted to the hospital and you don't need intensive care, but you need to be admitted beyond the ER. You occupy one of these med-surg beds. What we can see is there's been a sustained decline in the number of COVID positive patients represented in red in the med-surg beds for the past several weeks. The blue represents other people that aren't COVID positive that are in those med-surg beds. What you could do is look back here in May and June and see that there were well above 750 people on average that didn't have COVID that needed these med-surg beds on any given day. And today what you can see is there's still a fairly large proportion, maybe 20%, 20 to 25% of all the med-surg beds are occupied by COVID patients, where in the past they would have been occupied by non-COVID patients. So this again represents a little bit of the strain. You can see the strain on our hospital system here, where normally this would just be all people without COVID needing those med-surg beds. We can see the same sort of pattern in the ICU. Normally in the ICU, there's around 150 people, maybe a little bit less, that need critical care in the Coastal Bend area during normal times when there's not a lot of people needing ICU because of COVID. Here's what we've gone through with this outbreak, which is a massive burden on the ICU, where we went up to just as many people with COVID that needed ICU treatment as normally people in the Coastal Bend just on average need ICU treatment. So if you add on the 150 on top of that, we really needed maybe 150 beds being occupied by people that didn't have COVID to maintain the same level of care that would have been possible if there weren't all these people with COVID. And so that's important to recognize, and we're still not down to 150, and there's still well over 50, around 75 people with COVID that are in the ICU right now. So the ICUs are still stretched. We're not out of the woods here in terms of having normal hospital capacity to treat everyday sorts of conditions that occur. Okay, moving on to fatalities and our ranking within the rest of the state. There again, we're in fourth place, but we want to be in last place here. So this is moving in the right direction. We're moving down the ranking list, but we're still not as low as we'd like to be. So right now, on average, there's between 0.5 and 1 fatalities per day per 100,000 people in the Coastal Bend area occurring. That comes out to somewhere between 3 and 6, let's say, on average in the Coastal Bend area, fatalities per day. This is a huge number of fatalities. For the first several months of the pandemic, from March all the way through June, there were only 3 fatalities in Nueces and 4 fatalities in the Coastal Bend as a whole. Now we're having that many fatalities per day, and it's declined. We're on the downside of the peak right now. If we continue with the same regulations and the same behaviors that we've been exhibiting over the past approximately 2 months now, we'll continue to see these fatalities decline. I think everybody is aware at this point that the way that we count fatalities has changed, and by we, I mean the state of Texas, not we as the task force. So here in brown is the old way of counting fatalities, and we've continued this for Nueces, and the primary difference here between this brown and the red is that these cases were interpreted by the public health department here in the same way that the death certificates would be over here by the state, and they were just given to us sooner. So the new fatalities that you learned about today won't show up in this bright red data that's maintained by the state for at least 2 weeks. And it takes about 2 weeks for all the death certificates to be fully processed. And the way that you get counted by the state as a fatality or by the county here in Nueces is on the death certificate, the primary cause of death has to be COVID. If COVID is a secondary cause of death and not the direct primary cause of death, then it doesn't count in the system the state's using. or in the system the public health district is using to report the cases as they learn about them. So the effect of this is the official count by the state is represented here in the red, and right now it's at 407, and we know it's going to go higher because we already know there's been more new cases that haven't been counted yet. In the next 14 days, we expect that these will fill out. Our projection, which is based upon this counting methodology, so the circles represent the number of fatalities counted from death certificates where there's probably been enough time to count them all. And then the triangles represent the number of fatalities counted from death certificates where there hasn't been enough time to count them all by the state. So these are the state's reported numbers. This blue is our model projecting the number or fitting the number of fatalities that have occurred already. And then this purple or darker blue is projecting where we expect these average number of new cases or new fatalities per day to fall out after they're all counted from the death certificates. So we're going down, but not down this much, like what's indicated by those triangles right now. These triangles are going to move up. Okay, the last part of the presentation is on cell phone data, which gives us a little bit of a look into the future. Now, most of these figures were shown on Thursday also. Thursday is when the data is released, so by reviewing them on Tuesdays, they won't be too old, but we do have a couple new graphs in here. And if you're worried about privacy when you're using your mobile device and you enable an app to use your GPS, you're essentially volunteering to be tracked. This information is used to sell you things. It's sold. Your location data is sold, and we're able to obtain the anonymized data and use it not for targeted advertising, but we're using it for decision making and letting you guys know what we might expect in the future. In terms of potential encounters, which is when two cell phones come near each other, we've been trending upwards on the weekends. On weekdays, we've been leveling off, but this trend upwards is a bit concerning. Now, if we're doing really good at social distancing and wearing masks, then the increase in the potential encounters could not be indicative of an increasing transmission rate. But we shall see. Thus far, despite having well over a month of increasing potential encounters on weekends, we haven't really seen an increase in the transmission rate. So hopefully that's because of mask wearing and social distancing and proper hygiene. Schools, we know, are going to start to have increased foot traffic, and we can already see that foot traffic start to increase slightly at K through 12. This is probably administration and teachers at junior colleges like Del Mar and universities like TAMU CC. There's been an increase over the summer. Universities have leveled off recently, but we expect that with the next bit of data coming this week that we'll see an increase across all of these categories. In terms of visitors to the Coastal Bend, and this is something we've been tracking for several weeks now, there's been a slight uptick in the number of visitors that have been visiting restaurants in the Coastal Bend area. There's been about 74,000 visits to Coastal Bend restaurants between August 10th and August 16th. These lines show from the different parts of Texas from which the people came to the Coastal Bend that were eating in our restaurants. And here you can see the comparison through time. We've had a steady decline for the most part, and this is a minor uptick right now. We'll see what this looks like next week in terms of people traveling to the Coastal Bend, but presumably with schools starting again, maybe this amount of travel to the Coastal Bend will not reach the levels that it did in the early summertime. Reversing this around and looking at where we go, and these are just trips taken by people from the Coastal Bend over the weekend, or at least people over the course of the weekend from the Coastal Bend. Where did they go? There were 110,000 locations in the whole cell phone database that were visited by people from the Coastal Bend. You can see this heat map shows them spread all over the country, from Washington State all the way to New Hampshire over here, up into Wisconsin, down into Florida, pretty much touching almost every single state. This past weekend, with the exception of Maine, Vermont, even Connecticut has a little bit of highlighting there. Rhode Island, maybe not so much. And then every other state seems to have at least some bit of visitation from the coastal bend. So this shows how COVID can spread, not only from people coming here, but us going other locations and then coming back. So it's important when we're traveling, especially to be cognizant of social distancing and mask policies. Even if a state doesn't have a mask policy, by the way, you should wear a mask when you're traveling to that state. Okay, in summary, the Texas-wide outbreak is not over, but it's moving in the right direction. The number of new cases is declining. COVID-19 cases are declining in the coastal bend. They're declining statewide. ICU usage and fatalities are declining, but realize the ICU is still stretched. We still have more people in the ICU in the coastal bend right now than we would normally in non-COVID times. So that's something to realize. The transmission rate has been fairly stable, somewhere between 0.9 and 1.0 for the past several weeks. I'm attributing that mainly to our continued vigilance, wearing masks, as well as the continuation of state regulations to try to control the spread of COVID-19. We keep these same regulations in place, you can expect maybe not too much will change. Our need to continue efforts to reduce transmission continue. It's not time to relax yet, and it's not time to relax precautions. There's well more cases of COVID right now than there were around Memorial Day in the beginning of June when this current outbreak started to launch. If you're a manager or you're maintaining a business, you can help contain the outbreak. COVID's bad for business. So if you institute policies that help to stop the spread of COVID, you're helping your business ultimately. These are foregoing short-term bonuses for long-term gains. And so to accomplish this, use policies like no shirt, no shoes, no mask, no service. And really, I'd be okay with no shoes or no shirt right now, but the mask is the thing that I'm really concerned about if I'm running a business in the coastal bend. And it's important to close the loopholes in your social distancing policies because COVID can exploit them. Even in my own personal policies, somehow COVID has managed to exploit them. And again, I'm so unlikely to have contracted it that it just lets you know that anybody could end up contracting COVID. So how we slow down COVID-19, each of us can make a difference. Wear face coverings in public to decrease the transmission by up to 50% over not wearing face masks. Social distance, 6 feet or more. It's becoming more important to social distance more than 6 feet. The 6-foot regulation was based upon the idea that COVID was only transferred in droplets expelled through your mouth or nose that would fall to the ground within 6 feet. But there's been recent scientific evidence that I've talked about for the past 2 weeks that indicate that COVID can be spread in aerosols also. Aerosols spread more than 6 feet, and that's why social distancing pretty much as you can is recommended. Self-isolate when you're sick or exposed to not expose as many people to COVID as you might have otherwise. I demonstrated that by following the policies and by rolling back of open Texas policies that are in place and all these different policies that are in place to control the spread of COVID-19, that 1,000 less people were exposed to COVID just from me alone, let alone all the people that have COVID right now in the coastal bend area. Stay at home if you can. Practice proper hygiene and sanitize. Avoid social gatherings and patronize curbside and takeout. And most important, support testing and contact tracing. Really, the reason why I got tested was because to be able to come down there to City Hall today and be able to present with a clear conscience, because last week I had a little bit of symptoms that I thought I got from the flu shot. And surprise, surprise, I tested positive. So it shows you how important it is to go and get tested, even if you think you don't have it. I thought I didn't have it, and I did. And one last thing, wearing a mask works. These petri dishes were used to incubate colonies from droplets expelled from people's mouths after sneezing, singing, talking, or 2 coughs. The person that didn't wear a mask or that, didn't wear a mask spread the bacteria all over and droplets all over these Petri dishes, as evidenced there, and the person with a mask did not. The virus is transmitted in these droplets that come out of your mouth, and so wearing a mask prevents that. So it prevents you from infecting other people, and it prevents you from becoming infected. So with that, I'd like to acknowledge all the institutions that comprise the task force, the city, the county, the university, the public health district, and the Coastal Bend Regional Advisory Council, as well as many medical professionals and everybody else who helped to make this presentation possible this week. And we'll have a translation.
El doctor Chris Bird ha estado teniendo su reporte de manera remota ya que resultó positivo al coronavirus. Sus síntomas son leves y dice haber tomado todas las precauciones posibles, pero aún así contrajo el virus. Recuerde tomar todas las medidas de precaución para que el riesgo de contagio sea menor. El virus puede ser transmitido mediante superficies infectadas, así como el medio ambiente. El radio de transmisión continúa siendo bajo, es de una persona, o sea que si una persona está infectada, tiene el potencial de infectar a otra persona. En la área de la costa, la cual cuenta con 12 condados, se reportan 19.694 casos confirmados y no casos probables por el coronavirus. El porcentaje de casos positivos de pruebas realizadas por el Distrito de Salud es del 39%, mientras que en otras entidades es del 19%. La diferencia entre ambos porcentajes es que el Distrito de Salud solo realiza pruebas cuando se cuenta con síntomas. El área de la costa es la sexta región en el estado debido al número de casos positivos, lo cual es buena noticia. En cuanto a hospitalizaciones, el área de la costa se encuentra en cuarto lugar, detrás de Laredo, Victoria y el área del Valle de Río Grande. En fatalidades, el área de la costa también se encuentra en el cuarto lugar, detrás de Victoria, el área del Valle de Río Grande y San Ángelo. Según los reportes con teléfonos celulares, los encuentros entre personas sigue siendo mayor durante los fines de semana. En las escuelas, el tráfico ha aumentado también, posiblemente por los maestros que acuden a la escuela a dar instrucción. En la semana del 10 de agosto se estima que 74,000 visitantes viajaron al área de la costa. Le pedimos que continúe tomando todas sus precauciones sanitarias, así como las regulaciones estatales, para así prevenir más contagios.
All right, and with that, I think we'll take any questions that were raised from the Facebook Live.
Thank you, Dr. Bird. There was a discussion about masks in Facebook, and it had to do with Sweden's approach to their situation over there on COVID. So would you like to discuss masks and possible, outbreaks?
Sweden's approach to COVID is to have the people that are going to die as quickly as possible without overloading their hospitals. And so that's the approach that they're taking in an effort to attain herd immunity, which would be attained when somewhere around 70% or so of the population had become infected. The strategy that the rest of the world is taking is to delay you contracting COVID as long as possible until a vaccine or better medical treatment can be developed, so that you're more likely to survive and less people die, using the massive advances in medicine that have occurred over the last 102 years since the last global pandemic that we faced. Now, wearing masks will help a lot to stop the spread of COVID and to slow it down and enable the saving of a large number of lives over what would happen if we allowed COVID to rip through the population or do what Sweden's trying to do, which is they're still having a large number of people die compared to other countries per capita, but they're just trying to control the rate of the burn. It's almost like a controlled burn that they're trying to do. I would argue that our tack here in the United States is more humane, and I think it places more belief in our medical system that our experts and professionals that were trained in the best universities in the world here in the United States, with the best technology in the world here in the United States, will be able to come up with a solution to this and enable our loved ones that may have otherwise died be able to survive this.
Okay, thank you. And then lastly, your fatality graph, there was observations on Facebook that they think it looks lower than reality. So can you go over maybe that graph one more time?
This one? Am I projecting still?
No, it's just on you. You may have to explain it.
Okay, I'm projecting again. Hold on. Oh, I project. Can you see the slide now? Is
Yeah,
that getting projected?
I see this slide. It may be this slide that needs some explaining.
Okay, one more time. In the last month, the state changed the way that they counted fatalities. Okay, so the red represents the state's official count. It's based on death certificates and it's for the whole coastal bend area. So the 407 for today is indeed less people that have died up to this point than have actually died. And the reason why is because the state hasn't counted them yet. There's a stack of death certificates from each county that they need to go through and officially log, and it takes about 14 days for them to log them. In the brown, what we're showing is the number of fatalities that are given by the public health department here, where they find about them sooner. Now, the reason why this data point is less than 327 is because I find out about the today's numbers before or after I make the graph. So the graph will have another point tomorrow that will be 327, but this 327 represents the number of people that have actually died and been reported in Nueces County right now, matching what was presented in City Manager Zanoni's presentation. So I make sure that the number is as up to date as possible, even if I can't have the very latest data point on the graph here. But here, this is 407, but we expect that as things get counted, that's going to go higher. Hopefully that helps clear things up, and that we can't possibly compare to the rest of the state until the same process has gone through for each and every county in counting these death certificates, which is why we use this bright red number of fatalities, which is the state of Texas's official reporting of the number of fatalities.
And that's all the questions we have from Facebook.
Okay, thank you very much.
Okay. I think Annette and I are still here, so if there's any questions from either of us, we'll be glad to answer them from the media.
Wish I could have grabbed the judge before she left. I just wanted to know when the rescinding of the beach curfew goes into effect, her new order. Do you have any idea?
Robert?
That order was signed and goes back immediately.
Oh, it's immediate. So no curfew tonight?
No curfew.
Okay.
And I can get your copy.
What was the answer? No curfew? What, the question was what again? When is the?
The question was, when does the order rescinding the beach curfew go into effect? And he said immediately.
Okay. All right.
Which my follow-up to that would be, I know that Scott Cross thinks that the surf is going to come all the way to the dunes.
Yeah.
So the timing's a little
Odd, right?
Yeah,
Yeah.
but I mean, I guess you'll clear the beach if need be for safety,
We will,
regardless
right.
of any orders, right?
Right. The hurricane, Laura is going to have impacts on our coast. The hurricane's not going to hit wherever it hits, which is predicted to be between Texas and Louisiana, until the morning, until Wednesday morning. So we'll begin to see the effects probably tomorrow into Thursday. The city as well as the county are managing the beaches as well, so all of our equipment is off the beaches, lifeguard stands, porta potties, trash cans. And so we have police there and park persons as well, so we'll be monitoring, surveilling, making sure people aren't in harm's way.
Is that coastal beaches only or bay beaches as well?
Both. The Bay Beach is the same thing we're removing, but now everything's probably off the beach, and we'll be monitoring those as well. Yeah, especially North Beach. Was the most impacted by Hurricane Hannah. Okay, any other questions? Okay, we want to thank the two networks and others that are covering this event today. Today's Tuesday, so we'll be back here live on Thursday with an update on the numbers and general comments from Judge Canales and Mayor McComb. Okay, thank you all. Have a good night. Be safe.